nurses and nursing students. I've been a nursing professor for over 20-ish years. And as a clinical professor, at the end of a clinical day, I would do a special thing for my nursing students. I would read to them a story from Chicken Soup from the Nurse's Soul, a book which I love, or tell them miscellaneous stories and anecdotes from true nurses that gives them that boost of that's why we're in nursing. So some of my students have reached out to me recently as they are emotionally and physically exhausted caring for COVID-19 positive patients. And I've wanted so much to help relieve that burden because they are true heroes. So I'm bringing to you a revision of some stories that you can listen to while you're on your break or at home after a hard shift that hopefully reminds you this is why we went into nursing, the most honored profession and the true healer's art. So this story, in my own words and version, is from the story called The Night Al Heel Broke Loose. So Al Heel was one of those frequent flyers in an ICU unit, and the staff knew him and he came frequently for chronic issues. Well, he had a favorite nurse, and I call her Nurse Wanda. And they had a fun little banter between them. And whenever he would come into the unit, he would ask, is Wanda here? Because he really liked her. And she was a super small little thing, a little, 4'10" kind of little nurse, but had a lot of spunk to her. And she was a critical thinker because one night in the ICU, Al Heel had had enough. All of the alarms that were sounding, because you just worked a 12-hour shift and you were listening to all those alarms, right? So picture the alarms are going and we know the very real condition called ICU psychosis. Well, it happened to Al. And so they began, the regular shift, working through the shift, all the noises, all the chaos of a normal shift, until suddenly they heard extra alarms going off and they turned in the direction of where Al's room was. Well, Wanda was the nurse that night for him. And so she heard the alarms and she thought, what the what? And so she now saw Al out of his bed, had pulled out IV tubes and for some other line that's now got blood dripping all the way down. He's got a wild eye in his eyes, open eyes, wild man. And so someone now already called security because now they need backup because he's out. What's going on? Al, they're calling to him. No response. He's now in a different psychosis realm. So it became not funny when now he gets into another patient's room. And this patient was, of course, also in bed. He finds a letter opener, which is a sharp object, on like the bedside table. And he's now got this knife, letter opener, and he's wild-eyed, noises, alarms, dripping blood, fluids all over, and he's kind of like over the edge of this other patient who's looking on, fearful of what is this person doing. So it was not funny now. So security's now coming up. What should we do? Because now he's right, at the throat of this other innocent ICU patient. So Wanda, being a critical thinking nurse, does what any good nurse would do, like you. She's trying to get his attention. Ow, ow, ow. And he's, now he's got security and other nurses and somebody close by with Haldol ready to punch and inject. And she's like, shh. So then she takes off her scrub top, whips it around in the air, and starts saying, oh, ow, ow. And of course, like any good man, whoop, he's looking right at her and he starts walking, and everybody is now in on, I see what you're doing, Wanda. Do that. Get his attention. Let's get him back to his room. So, of course, now he's going. Just then he hears now a distraction from the security guards now who are all trying to come back. She loses attention and now he's concerned about the security guards that are all going to be trying to get him. And so what does a good thinking nurse do? It's not in the textbook she'll ever read. She now skimmies down her scrub bottoms. There she is, Wanda, in all of her little bra and panty glory. And she now starts, again, swinging the clothes. Come on, Al, come on. Come back to bed with me. And, of course, Al is like, whoa. And so he starts walking. Everybody's quiet, right? Let Wanda do her magic. So she leads him back into his ICU bed. She lays down on the bed, pats the bed next to her, waves him in like, come on, Al. She gets him to lay down, with her arm around him. She turns him over to her, and bam goes in the Hal doll, and out goes Al. Now, she became a legend on that unit because she used her fast, quick-acting action to really solve a critical problem. So that's our hero, Nurse Wanda, the night Al heel broke loose. Now, you're the same kind of a nurse. All right, maybe we'll keep your clothes on. That's not what we're promoting here. But you're a critical thinker, and you can do this because nursing is an honored and a spiritual, and may I say, a sacred profession. And we have the right to receive that instant revelation for what we need to help our patients with what they need at the time so that they can heal. So with that, have a great rest of your shift. Thank you for being a nurse. I'm so proud of you. It's an honor to be your nursing colleague. And with that, happy healing.